Hi, this is Dr. James Hutcherson, and today I'm going to talk about articulations, otherwise known as joints. So I'm going to share my screen with you, the PowerPoint. All right, so first of all, let's just talk about what joints or articulations really are. So your book says they're the functional connections between bones. And really, simplistically, that's very true. It's where any two bones come together. They bind parts of the skeletal system together. They make bone growth possible. They permit parts of the skeleton to change shape during childbirth. And they enable your body to move in response to your skeletal muscle contractions. Of course, your muscles are attached to the bones, and they are attached at or across those articulations, which allow bones to be pulled towards a particular position. Okay, there's two kinds of ways to classify joints. And if you ever get a question on the test asking about classification or in your laboratory, this is what it's asking for. Okay, so either, usually you're going to give one of each. You're going to give a structural classification and you're going to give a functional. Okay, so at the most simplistic level, you have fibrous joints, which are held together by dense connective tissue. Cartilaginous joints, they're held together by cartilage. And synovial joints, which have the most complex structure to them. And we'll talk quite a bit about those because those are like the joints of arms and legs. Functional classification is the next way we classify or identify the joints. They can be synarthrotic, amphiarthrotic, or diarthrotic. Synarthrotic means they are immovable. Amphiarthrotic means slightly movable, and diarthrotic means freely movable. Okay, so let's look at a little bit more detail here. Let's start talking about fibrous joints. So now when we look within this structural classification, we can then go even further with subcategorization. Okay, so fibrous joints, they're held together with dense connective tissue, as we said, containing many collagen fibers. They're found in bones in close contact, and there's three types of fibrous joints: syndesmosis, a suture, or a gomphosis. So let's talk about each of those. Okay, the syndesmosis. These are bones bound by a sheet of dense connective tissue, in this case interosseous membrane, or it can be a bundle of dense connective tissue like interosseous ligaments. They are amphiarthrotic, which means they're flexible and they might twist, so they're slightly movable. Syndesmosis, a good example, is between your tibia and fibula of your lower leg. Okay, so there's your tibia, there's your fibula, and here is that interosseous membrane. So this is an articulation or joint. Again, it's a fibrous joint, specifically a syndesmosis. Okay, next, another type of fibrous joint is a suture. This is a thin layer of connective tissue, which we call a sutural ligament, and it connects bones. They are synarthrotic, which means they are immovable. You'll find these between the flat bones of your skull. So yes, those are considered joints. And then you have gomphosis, which is cone-shaped bony process in a socket. They are synarthrotic, which means immovable. And we are talking about the root of a tooth in your maxilla or your mandible. So these are held in place by a periodontal ligament. So that's a gomphosis. Okay, and figures 8.3 and 8.4 here show you the suture. Again, that's a type of fibrous joint. And then the gomphosis, which is where the tooth fits. Now, you'll recall early on in development, the sutures are actually very soft. They're not hardened bone, and this does allow the child's head to easily move through the birth canal. Okay, so that was fibrous. Now let's talk about cartilaginous joints. Okay, so cartilaginous joints connected by hyaline cartilage or fibrocartilage. There's two types of cartilaginous joints, a synchondrosis or a symphysis. So let's look at those. The synchondrosis, it's a band of hyaline cartilage that unites bones. And as you might imagine, it's synarthrotic, which means it's immovable. Some of them are temporary, like the epiphyseal plates in the heads of your long bone. So these are ossification centers, and they will eventually be converted to a synostosis. Some are permanent, like between the manubrium and the first rib. That's the costal cartilages that attach there. Okay, symphysis is a fibrocartilage between bones. The articular surfaces are covered by hyaline cartilage of your bones, where they come together at the joints. And remember, an articular surface are where the two bones come together. They're amphiarthrotic, which means limited movement. And one of the areas where we see symphysis is the pubic symphysis, where the two pubic bones come together. It's a joint between bodies of adjacent vertebrae also. These we call the intervertebral discs. So each area between your vertebrae are fibrous material, and you'll remember it's fibrocartilage, and they help join those two vertebrae together. This is, again, a cartilaginous joint, specifically a symphysis. Okay, here's figure 8.5 and 8.6. So cartilaginous joints, again, we have synchondroses, okay, and then we have the symphysis. All right, now let's move to the more complex of the structural classifications, the synovial joints. Most joints are synovial joints. All of them are diarthrotic, which means they are freely movable. They have a more complex structure than the fibrous or the cartilaginous joints. And let's talk a little bit about that structure. So you have an articular cartilage that covers articular ends of your bones, and then you have a joint capsule, which has two layers. You have an outer fibrous layer that's composed of ligaments, and then an inner layer of synovial membrane, which secretes synovial fluid. And the purpose of this is to help with impacts and also reduce on friction. Okay, the synovial joints consist of all these parts: an articular cartilage, a joint capsule, ligaments, synovial membranes, synovial cavities, synovial fluid, a meniscus in most, well, in some joints, and then a bursa in some of your joints. And this shows that basic structure. So here's two bones where they come together. You have a joint cavity. You have an articular cartilage at the end of each of the bones. Then you have a synovial membrane that surrounds it. And outside of that, the fibrous capsule. Altogether, that is your joint capsule. Here is a side or lateral view of that. Okay, and in this picture, you can actually see the menisci. You see that material at the front and the back. There are 6 types of synovial joints classified by shape and movement that they allow. Okay, the ball and socket joint. This is also called a spheroidal joint. Has a round head that fits into a cup-shaped cavity, and it has the widest range of motion. It's multi-axial, and it has rotation. An example of these are your hip, like where your femur fits to the hip, and then your shoulder where the humerus fits to the scapula. Condylar joints. These are also called ellipsoidal joints. It's an oval condyle which fits into an elliptical cavity. They do allow back and forth and side-to-side movement. We say they are biaxial in their movement. They do not have rotation, though. And here you're going to see joints between the metacarpals and phalanges, for example. Okay, and that, of course, is between your hands, or the palms, really, and the fingers. Okay, figure 8.9a and b. Again, these are synovial joints. This is a ball and socket. You see why it's called that. And the second one is the condylar joint. Okay, a plane joint. This is also called a gliding joint. They're almost flat or they're slightly curved. They have back and forth and twisting motions. We say it's a non-axial movement. And these you'll find in the wrist and the ankles. Okay, next, the hinge joint. It's a convex surface that fits into a concave surface of other bones. It's uniaxial, which means in one plane, and examples are like your elbow and your joints between your phalanges. Okay, here figure 8.9c, we see the plane joint, and you see the model of how that basically works. And then we have the hinge joint, and you see how that fits together and works. Okay, pivot joints. These are also called trochoid joints. We have a cylindrical surface, rotates within a ring of other bone. It allows uniaxial movement, but it's rotation only. And here, the best example is where the atlas and dens of the axis come together. And that's where basically your head fits into your neck area or those first vertebrae, so that you're able to make that no motion. The saddle joint, this is also called a sellar joint. Both bones have concave and convex surfaces. It allows biaxial movement in two planes. And here we're talking about the carpal and metacarpal of the thumb. Okay, in figure 8.9e, you see a pivot joint. Again, it's uniaxial. And in F, you see the saddle joint. Allows biaxial movement. Okay, so we went through the structural classifications and a little bit about functional. And at this point, we'll get into a little bit about more about functional. And we have different terms we use for the different types of movements. But first of all, the action of the skeletal muscle produces movement at synovial joints. Okay, and so you have an origin and an insertion. An origin is the fixed end of the skeletal muscle. The insertion is the movable end of the skeletal muscle. Okay, and remember, these muscles are connected to the bones by tendons. Okay, so it's really the tendons that are connected at the origin and the insertion with the muscle in between. A movement at a joint occurs when a muscle contracts and the fibers pull the insertion towards the origin. Okay, so here's some terms that we use. Flexion means bending of part at a joint. And usually we're talking about reducing the angle between the two bones. So like if you're forming the muscle in your arm, like your biceps brachii, and you pull, say, your hand toward your shoulder. So that's flexion. Now, when you release that and go the other way and you increase the angle, that is called extension. A hyperextension is if you can extend beyond the normal anatomical position. And some people have more flexibility than others, as you know. Okay, lateral flexion means bending to the side. Abduction means moving a part of the body away from the midline. And adduction is moving a part of the body toward the midline. And we're going to look at some pictures of these. Okay, so here in this first picture, you see abduction, where you're moving the leg away from the center line, adduction, moving it back towards, and you can think of this like you're adding it back. Okay, lateral flexion, moving your whole body from side to side. Okay, in C, you see flexion. Again, we're reducing the angle between two bones. Extension is the opposite. Okay, also in D, you see another example of flexion and extension. And again, it has to do with the angle, right? So in flexion, you reduce the angle between the 2 points of movement, and extension, you're going the opposite way. And also in E, you see another example of flexion and extension. And again, it has to do with the angle with the body. Okay, some other terms. Dorsiflexion. This is ankle movement which points your toes upward. Okay, the opposite is plantar flexion, the ankle movement which points your toes downward. Circumduction is movement of the part of the body in a circular path. Rotation is different. This is moving a part of the body around an axis. Medial rotation, this is movement of a limb so the anterior surface moves towards the midline. Lateral rotation, movement of the limb so the anterior surface moves away from the midline. Supination, the forearm rotation so the palm faces upward or forward, or lying down face up. Pronation is the forearm rotation so the palm faces downward or backward, or lying down face down, which we call prone. Okay, here's some images which show this. Again, dorsiflexion is bringing your foot upward, pointing your toes up. Plantar flexion is the opposite. Circumduction, rotating your arm around the central axis of your shoulder. C shows medial rotation and lateral rotation. And then D, supination, pronation. Continuing on, inversion. This is turning the foot so the plantar surface faces the midline. Eversion is turning of the foot so the plantar surface faces away from the midline. Protraction is movement of the body part forward. Retraction is movement of a body part backward. Elevation, this is raising a body part, and depression is lowering a body part. Okay, some more images for you. In A here we have inversion, and the second picture is eversion. Okay, B here, protraction, like moving the head forward. Retraction, moving it backwards. Okay, elevation, this is raising your shoulders up. Depression is lowering the shoulders. Just one example. Okay, let's talk more about some of the specific synovial joints because they're all very different. Again, these are complex joints and are freely movable. And the ones we talk about most often are the shoulder, the elbow, the hip, and the knee. Okay, the shoulder joint. It is the ball and socket joint, and the head of the humerus fits into the glenoid cavity of the scapula. It has a very loose joint capsule. It does have ligaments that connect bone to bone, so the ligaments prevent displacement. It has a glenoid labrum tissue. It has several bursae, and it has a wide range of movement, including rotation and circumduction. Major ligaments of the shoulder joint are the coracohumeral ligament, the glenohumeral ligament, and the transverse humeral ligament. And notice that the joint ligaments are named after parts or bones that are connected. And this is the image of the shoulder joint. And this shows the ligaments of the shoulder joint. And notice there are several, and they attach at several places. And all this time you may have been wondering more about why we ask you to know certain parts of bones. This is one of the reasons, because a lot of these projections or raised areas are areas that the tendons attach to, or the ligaments attach to also. Okay, elbow joint. It has two articulations. You have a hinge joint, which is between the trochlea of the humerus and the trochlear notch of the ulna. This allows flexion and extension. And then there's a plane or gliding joint. This is between the capitulum of the humerus and the fovea on the head of the radius. It allows pronation and supination. It has several reinforcing ligaments. And some of the major ligaments that you will see in the elbow joint are the radial collateral ligament, or RCL, the ulnar collateral ligament, or UCL, and the annual or annular ligament. Okay, so you see this is quite complex, but again, only allows a couple of movements. And this shows you the ligaments of the elbow joint. Again, there are several. Let's talk about the hip joint. This is the one you probably have heard the most about, because if someone's going to have a problem with their articulation of joints, it's going to be the hip, especially as you get older. It's a ball and socket joint. The head of the femur and the acetabulum of the hip bone are what come together. You have an acetabular labrum. You have a very heavy joint capsule and a lot of reinforcing ligaments, and it allows many different types of movements, but actually less than the shoulder joint. Major ligaments of the hip joint include the iliofemoral ligament, that's the strongest ligament in the body, the pubofemoral ligament, and the ischiofemoral ligament. And again, notice the ligaments being named of the bones or the parts that are attached together. Okay, this shows that joint. Now, one reason why we have more problems, of course, with this joint, and also one reason why it's much better reinforced, is because it takes so much of the weight of your body and a lot of impact. Okay, here we again see the ligaments of the hip joint. Okay, the knee joint. It's the largest and most complex synovial joint. It consists of 3 bones. The femur, so that's the medial and lateral condyles of the distal end, with the tibia, that's the medial and lateral condyles of the proximal end, and the patella, which articulates with the anterior surface of the femur. It is strengthened by many ligaments and tendons. It's cushioned by the bursae and fat pads. You also have menisci that separates the femur and tibia, and you've probably heard of people having trouble with the meniscus or have a torn meniscus. It is a modified hinge joint that's between the condyles of the femur and tibia. You have a plane joint between the femur and the patella, and the movements are flexion, extension, and some rotation. Okay, again, you see how complex this is and how large it is. Again, it takes an extreme amount of impact. And I expect you've heard of some of these ligaments. These often are the ones that people tear or they get damaged from many different reasons. The patellar ligament, the oblique popliteal ligament, the arcuate popliteal ligament, the tibial collateral ligament, or the TCL, the fibular lateral collateral ligament, or the FCL, the anterior cruciate ligament, or ACL, that one you've probably heard a lot of, and then the posterior cruciate ligament, or the PCL. And you see how all of those ligaments are tied in. And again, this is so necessary to try to keep that joint and those bones in place and to give it lots of structural support. Okay, the clinical applications are joint disorders. So joint injuries result from trauma and overuse, an infection, inappropriate immune attacks, and degeneration. Arthroscopy is used to treat shoulders and the elbow and the knee injuries, and we can use that to diagnose for certain conditions. Dislocations, of course, happen quite often. This is displacement of the articulating surfaces. This is common in the shoulder, the knee, the fingers, and the jaw. Okay, you've probably heard of sprains before. This is tearing of the connective tissues in the joints, and this is when you have no dislocation with it. Now, you can have a torn ligament, and that results from twists or overextensions, lifting heavy objects, or falling. Bursitis, this is inflammation of the bursa, and this happens because of overuse or stress of those joints. And then, of course, arthritis. This is inflammation, swelling, and pain in a joint. And there are several types, really. Rheumatoid arthritis is an autoimmune disease. So that's when your own antibodies started and white blood cells start attacking your own joints. Osteoarthritis, this is degenerative. It's the most common type, and it occurs with aging. And then there's Lyme arthritis. This is caused by Lyme disease that's passed through tick bites. You've probably heard of people having joints replaced. There are synthetic materials that can be used to replace the joints. There's steel, there's titanium. These can replace the larger joints. And then there's silicone that can be used for the smaller joints, and even some are ceramic. Most common replacements are hip replacements. And some new technologies for joint replacement. There's use of materials that resemble natural body chemicals, like certain coatings that implant with hydroxyapatite. And then there's 3D printing technology now that we can create custom replacement joints. Okay, lifespan changes. Well, joint stiffness is very common as you get older. Many people develop arthritis as they age. You can help with a lot of this with certain types of anti-inflammatories or continuing to take calcium supplements. Fibrous joints are the first to change. They can strengthen, however, over a lifetime. Cartilage and synchondroses starts to stiffen. Ligaments lose their elasticity, so people start having a little bit more trouble being flexible. You have changes in your symphysis joints of the vertebral column. This diminishes your flexibility and also decreases your height. And that's because of water loss from the intervertebral discs. Synovial joints will lose their function as the capillary supply diminishes. And just not using your joints. This will hamper the nutrient supply to joints and speeds up stiffening. And this is why doctors are always recommending to people to continually move. You know, try to get your 30 minutes in a day of some type of activity. And activity and exercise can keep the joints functional longer. So that is imperative. And that, my friends, is the chapter on articulations or joints.